Ancient medicine is often viewed as primitive, and some practices seem downright bizarre by today's standards. However, many strange ancient medical treatments actually had real therapeutic benefits and laid the groundwork for modern medicine. Here are 10 of the weirdest ancient medical practices that surprisingly worked. 1. Bloodletting, draining to heal. Bloodletting was used to treat everything from fevers to headaches. While overuse could be dangerous, in certain cases, like hemochromatosis, a condition of excess iron in the blood, bloodletting helped regulate iron levels effectively. 2. Trepanation, drilling holes in the skull. Trepanation, or drilling a hole into the skull, was believed to treat mental illness or relieve pressure after head trauma. Shockingly, some trepan patients survived, and this practice may have helped reduce intracranial pressure caused by injuries. 3. Honey as an antiseptic. Ancient Egyptians used honey to treat wounds and infections. Due to its natural antibacterial properties, honey effectively prevents infection and promotes healing, a practice still in use for some wounds today. 4. Maggot therapy, cleaning wounds. Maggots were used in ancient times to clean wounds by eating dead tissue while leaving healthy tissue unharmed. Modern medicine still employs maggot therapy in some cases to treat chronic wounds and prevent infection. 5. Leech therapy, drawing blood for healing. Leeches were widely used to remove bad blood and treat various conditions. Today, leeches are used in microsurgery to improve blood circulation and prevent blood clots, especially after limb reattachment surgery. 6. Acupuncture, needles for pain relief. Originating in ancient China, acupuncture involves inserting needles into specific points on the body to treat pain or illness. Scientific studies now support acupuncture as an effective treatment for chronic pain, migraines, and anxiety. 7. Willow bark, nature's aspirin. Ancient Greeks and Egyptians used willow bark to relieve pain and reduce fever. Willow bark contains salicin, a natural compound that is chemically similar to aspirin, and it remains a natural remedy for inflammation and pain relief. 8. Cauterization, burning to heal. Cauterization, the practice of burning tissue to stop bleeding or prevent infection, was common in ancient times. Today, electrocautery is still used in surgeries to control bleeding and remove damaged tissue. 9. Herbal remedies, plant-based medicine. Ancient civilizations like the Greeks, Romans, and Chinese used plants like garlic, ginger, and turmeric to treat ailments. Many of these herbs are still used in modern medicine for their anti-inflammatory and antimicrobial properties. 10. Egyptian moldy bread, early antibiotics. Ancient Egyptians applied moldy bread to wounds to prevent infection. The mold contained natural antibiotics, similar to penicillin, that killed bacteria, centuries before the discovery of modern antibiotics. Although ancient medical practices may seem strange or even dangerous by today's standards, many of them had real healing properties. These methods reflect the ingenuity of early civilizations in their attempts to cure illness, some of which continue to influence modern medical treatments.